that you said to the Prime Minister?
So what did I say to him? I said, as a future doctor, what guarantees can you give me that the system that I work in will have drug accessibility? And then I also said, and as a doctor who will be working in the future, how will you prevent the climate crisis that is currently being allowed to continue under your government?
On the 1st of May, 2019, the UK government declared a climate change emergency. But what does this actually mean for doctors and their allied health professionals? Doctors need to be aware of the effect of this emergency both on health and on health systems, as well as their power and responsibility to adapt to and mitigate these changes. Climate change has both direct and indirect health effects. Extreme weather events cause hundreds of people in the UK to die every year of heat stroke, and this is predicted to rise to thousands in the coming years. Flooding displaces communities and leads to contamination of fresh water and outbreaks of disease. Air pollution is contributing to airway disease in our increasingly urban population. Rising temperatures globally will lead to the spread of infectious diseases such as malaria. Indirectly, climate change will contribute to food and water security issues in the UK, as well as increasing migration. These effects will be disproportionately shouldered by those who are already disadvantaged and susceptible, thereby worsening the health gap. An already stretched NHS must adapt if we're going to meet the increased demand which climate change will bring. However, the NHS is already partially responsible for this problem. The NHS contributes 5% of UK's carbon emissions. Of this, 60% comes from procurement. This concerns purchasing of instruments, drugs, and surgical supplies which doctors use day to day. This means the clinical decisions doctors make can directly impact the carbon footprint. The NHS itself predicts that a large proportion of the changes that need to happen to meet emission targets will be clinician-led. Here's how you can play your part. You can make a difference straight away in your specialty. Contact your Royal College or the Center for Sustainable Healthcare to join or start a working group. Within your hospital, you can set the ball rolling by starting sustainable quality improvement projects, switch to using resources, drugs, and instruments with a lower carbon footprint, avoid unnecessary procedures to reduce waste. As an individual doctor, you're in a privileged position to make a difference at the patient level and prevent patient harm from climate change. Don't forget that your voice is a trusted one. Become a climate change advocate by joining groups such as Fossil Free Health, Clinicians for Planetary Health, and Doctors for XR.